Why is adamantinoma one of the rarest bone tumors? Imagine a tiny, slow-growing tumor that almost never makes headlines because it's so uncommon. That's what makes adamantinoma stand out among bone cancers. It accounts for less than 0.5% of all primary malignant bone tumors. To put it in perspective, only about 1 in 900,000 people in Europe will develop this tumor during their lifetime. It's so rare that doctors and researchers often see only a handful of cases over many years. This rarity is mainly because of where and how it originates. Adamantinoma almost always starts in the long bones of the lower legs, especially the tibia, which is the shin bone. Over 80% of cases are found there. Sometimes it appears in other bones like the upper arm bones or the thigh bones, but these are very rare. Its specific location and slow, low-grade malignancy make it less likely to be diagnosed early or even recognized. Since it grows slowly and doesn't cause aggressive symptoms right away, it can be mistaken for other benign conditions, leading to underdiagnosis. Another reason for its rarity is that it affects mainly young adults, usually those in their 20s or 30s. It shows a slight preference for males, but overall, the demographic is quite narrow. Unlike some cancers linked to lifestyle, environment, or genetic factors, the cause of adamantinoma remains unknown. It appears sporadically, with no clear risk factors or inherited predispositions identified so far. This makes it even more difficult to predict or prevent. Because of its slow growth and subtle symptoms like mild pain or swelling, many cases might go unnoticed or be misdiagnosed as benign bone lesions. This diagnostic challenge can also contribute to its low reported incidence. Despite being so rare, understanding and studying adamantinoma is important because it can recur locally or spread to other parts of the body if not treated properly. From a research perspective, the rarity of this tumor makes it tough to gather enough patients for large studies. This limits our understanding of its biology and the development of targeted treatments. Fortunately, most patients do well after surgical removal of the tumor, with high survival rates. Still, the risk of recurrence means careful follow-up is essential. In summary, adamantinoma's status as one of the rarest bone tumors comes down to its very low occurrence, specific location in the bones, slow-growing nature, and the fact that it mainly affects young adults. Its rarity presents challenges for diagnosis, research, and treatment, but ongoing studies continue to improve our understanding. If you or someone you know is facing a bone tumor diagnosis, always consult healthcare professionals for personalized advice and care.